Hi, today welcome to the short discussion with Somshekar D. He is a senior spine surgeon and also he is a minimally invasive and keyhole surgeon for the spines. So we'll have some basic questions about back pain, neck pain, and the slip disc. These are the common three things most people have some doubts. Maybe other specialities, general practitioners, including the people. So I'll ask questions as if public wants it. So let's start with the back pain. So back pain is one of the common thing people visit physicians, orthopedics, and even spine surgeons. So let's start with what are the common causes of back pain in clinical practice.
So, back pain now it is epidemic because of COVID. After that, so the back pain is very epidemic, and 90 to 95% of the human beings will suffer from back pain once in a lifetime at least.
95%.
95%.
Okay.
So it is the data.
Okay.
And the causes being the most common cause is a wrong posture. That leads to muscle strain or muscle strain. That is the most common cause. So other common causes are disc problem, or due to the aging problem, or bone weakness because of aging, and other rare causes are like fractures, or due to infections, or due to tumors. Tumors means cancers. So these are the rare causes of back pain. But I can say most common cause is muscle strain due to wrong posture and a disc problem.
So nowadays, this as the human evolution, many people are like sitting and working. So what percentage of back pain is because of the posture itself?
So when a patient comes to us and asks us, "What's our doctor? I have a back pain, and what is it cause?" We first ask is, "What is your profession?"
Okay.
Because so majority of the back pains are due to wrong posture. That too major seen in IT people.
Yeah.
So I can say about 70 to 80% of my patients are due to the back pain due to the wrong postures or muscle strain due to improper sitting postures. So all those.
That was this. Okay. So like all back pains are not dangerous. Okay. So when should we worry about back pains? Like for example, many people know common thing in India is when they have a back pain, they go to pharmacy, they take some medication, or they'll think that some medicine given to his family member, the same medicine they'll repeat. So when there are situations where they should consult a spine surgeon and should not neglect, they have to evaluate further.
So there are some signs called red flag signs we say in our terms. Red flag signs means if this signs is seen in you, then you should immediately contact a spine surgeon.
Okay.
So these are the basic red flag signs are. So whenever the patient has a weakness in the leg, weakness means so they won't be having power in the leg to walk, or they'll feel like numbness in the leg, or if they develop any urine problems like they cannot control the urine is passing in by themselves, and they cannot fully pass the urine. So all those things are urinary symptoms, which is also a red flag sign. And other red flag signs are if the patient is having fever, or if he is having any weight loss which is unexplained,
Okay.
or anything which is causing him not to walk, bedridden.
So one is like weakness, fever or weight loss, and bowel and bladder issues.
Disturbances.
These are things are that means something is really serious, and you should not neglect.
And one more thing is, if patient is having not getting relief by even after 1 or 2 months of physiotherapy or medications, then it's a red flag sign that you have to see spine specialist.
And most of these patients what have red flags, they also need a MRI.
Yes.
So what do you think? What happens? Suppose I am a physician. If I see any of these things, should I get an MRI and then refer to a spine surgeon, or any specification for the MRI, and what percentage of these people need MRI?
So patients with back pain, 90% of the patients with back pain, there is no need of MRI. We usually treat with all types of physiotherapy and medications, but only 10% need an MRI. So, but patients with a red flag sign, in my opinion, is straight away go for MRI. Don't hesitate to get an MRI done if red flag signs are there. Otherwise, for other back pain, 90% there is no need of an MRI. Only 10% need.
So, any specification for the MRI? Like you do only a particular spine involved, like LS spine or whole spine screening?
So usually we get an MRI where pain is being localized, but along with that, always get an whole spine MRI, because many a times there is a 10 to 20% chance that they have other problem in other part of the spine. So which is very important while we treat them.
So one is the MRI of the particular affected spine and the whole spine screening. Okay. And some mild back pains, people get the X-ray sometimes. X-ray. Okay. So apart from MRI, what all information we can get from simple X-rays?
Usually, so the basic investigations before an MRI is an X-ray. So X-ray is always a basic investigation. It can never replace an MRI. So so people will think X-ray we cannot see anything, but lot of information we get in X-ray. So that is in X-rays we can see if there is any displacement of the bones. We can see that is one bone has moved over the other bone, or there is any significant angulation of the bones we can see, and we can also see the quality of the bones. So if there is any weakening of the bones, severe osteoporosis can be seen in X-ray, and all age-related changes also can be seen in X-ray. And we get lot of information in X-ray, not only the simple basic information. We get lot of information in X-rays.
So any situation when you need both X-ray as well as MRI?
So most of the times, usually when we want to go for surgery, usually get both the X-ray and MRI. But usually for all the patients, we usually initially get an X-ray, and based on the X-ray, or if the patient is not getting relief, then we go for MRI.
MRI. Okay. So what are the non-surgical treatment for the back pains normally?
So the good news is most of the back pain we usually treat with non-surgically only.
Okay.
So 90 to 95% of the back pains can be treated without the surgery.
Okay.
So usually we start with medication, simple painkillers and muscle relaxants. Then we also advise them to go physiotherapy. Like many physiotherapeutic modalities are there, which is given locally. And third thing is exercises. So usually for back pain, we usually give core strengthening exercises. And before the strengthening exercises, we basically do stretching exercises to relax the muscles first. Later we go for strengthening exercises, like core strengthening exercises. So this is in physiotherapy. So we treat with medications, physiotherapy, and we also suggest to go for walking, swimming, all the sports related activities, everything you can do slowly once the pain comes down. And if pain doesn't come down with all these therapies, we have a second step called as injections. We usually give injections like epidural injections, facet injections, then root blocks. All those things are non-surgical methods to treat the back pain.
So you mean like suppose somebody is having a back pain because of sprainers, this one, how long it will take?
So usually the acute sprain will settle down in 3 days to 1 week. But back pain due to the disc problems or back pain due to the age-related problems, sudden annular tears. So basically majority of the back pains will be reduced in 6 to 8 weeks.
So 6 to 8 weeks.
Will reduce in
In the 6 to 8 weeks, suppose somebody is a diabetic and not suitable to give a long-term painkillers. So we can't give painkillers for 2-3 weeks continuously. In such situations, how do you manage?
So usually in such situations, we usually for all of our patients, we usually suggest painkillers only for 3 days to maximum 7 days. So following that, because majority of the back pain, I can say 80 to 90% of the pain comes down with these painkillers and physiotherapy. It is a local physiotherapy like IFP, TENS. But after the 7 weeks, so even after that, if the patient has a pain, we usually try to control with physiotherapy, and there are safer medications which we can continue for 2 to 3 weeks like paracetamol. That is 1 gram paracetamol usually give, that we can extend up to 2 to 3 weeks. But we cannot give other painkillers for 2 to 3 weeks. But
because it's one of the common problem. People you given painkiller for 1 week and they continue for 3-4 weeks and they end up in some other issues like kidneys and other things.
That is not to be followed because that is very dangerous thing. So only the painkillers which we prescribe for 7 days is to be taken only for that duration. We cannot extend that for long period of time. So if the pain is still continuous, we usually suggest there are some local physiotherapy like ultrasound, TENS, IFTs, and cupping, needling, all those things we try even after 1 week if patient has pain. Even then, if patient has pain, then we usually go for injections like facet injection, epidural injections, and blocks.
So, as per your experience, what is the one thing you can tell the patients, prevent people, to the audience, like prevent back pains?
So, back pain is better prevented rather than treated. So, back pain, the best prevention is, I usually suggest patients go for lifestyle modifications like exercises, walking, yoga, gym, swimming, all those things. Second thing is proper posture is the most important thing in nowadays.
There is a confusion. What is a proper posture?
So proper posture, there is basically for a back bend, there are few things to be followed. So basically, whenever you have to sit with a back support. Second thing is, whenever you see the screen, your eye level should be at the upper part of the screen. And third thing is, you should take frequent breaks in between every 30 minutes, 45 minutes. You have to get up and bend that side, and take a break and take a small brisk walk and come back. And whenever you sit, your feet should be on the floor and your arms should be on the armrest, and you should be sitting straight. So these are the basic posture we should follow, and majority of the back pain can be avoided by following these things. So mainly preventive quick tips are: go for lifestyle changes, proper posture, and do exercises and yoga.
So very valuable information regarding the back pain. So next video will go further regarding the neck pain.